This audio podcast, is part of a Segmental Scruples series or edition. This audio podcast is part of a Rampage Sonar. This audio podcast is part of a Blitz Libostics, and this audio podcast is part of a Storm Libostics production. In this audio podcast, Synopsis, a little bit around the overview of this series. And before sort of delving into the synopses, to inform that an audio podcast in around this works had been informed previously, and previously. However, as part of this audio podcast series, or as part of the this audio podcast, there have been sort of a contemplation to go over sort of drafted works, and thus to put the sort of drafted works out in amongst a series, an audio podcast series, as part of a series, rather than, for example, just a sort of a one-off sort of audio podcast, and so thus this audio podcast this audio podcast series in around looking at the need to again to in around the need to consider renal health in transfusion, in amongst transfusion care, and sort of research to inform best practice or best practices, where this works sort of goes through the drafted works in as part of an audio podcast series, rather than sort of a sort of one-off audio podcast, which again have been done previously. And so in around the synopses, the number of patients or recipients with multiple long-term conditions or long-standing conditions and or chronic illnesses has set to had increased from 1.9 million in 2008 to 2.9 million in 2018. Some patients and recipients at the same time cannot receive or have cannot receive and or refuse transfusion, red blood cell, for example, red blood cell transfusions, and there are no universally sort of accepted treatment guidelines or guidelines for managing care in such recipients or patients. This is the case. This is the case in amongst sort of transfusion, in amongst sort of hematology and transfusion practices, or practices in laboratory, amongst the laboratory sort of guidelines, universally. So in around the objectives of this as part of this audio podcast series was to highlight the need to consider renal health in transfusion care, and amongst transfusion care, and sort of look at look to consider renal health in amongst transfusion care practices, and thus to help inform best practice or best practices. Now the aims around this works were the aims around this works included: number one, to understand what further aspects of care practices are required for patients with long-term conditions or long-standing conditions and or chronic illnesses. Number two, highlight what practices would support the development of transfusion care guidelines. And three, provide an understanding of sort of treatment alternatives, taking renal insufficiency taking renal insufficiency into consideration. In around the sort of methodology or the design around the sort of drafted works, but also as part of the audio podcast, as part of the audio podcast series. 450 abstracts were identified. 274 papers were cross-examined utilizing a critical appraisal skills program. 82 papers were evaluated to, number one, understand the needs, number one, to understand the requirements, the requirements for patients in around transfusion care, around transfusion care to consider for patients or recipients with long-standing condition, long-term conditions, and or chronic illnesses. Number two, what practices would help develop transfusion care guidelines, transfusion guidelines, and three, provide an understanding of present indications for RBTs. In around sort of the findings, or in around the findings and sort of the findings and sort of the themes derived from this around this works. As part of this works, number one, a lack of renal health in transfusion care strategies for patients with chronic illnesses, with chronic illnesses. Number two, managing anemia in the chronically ill and transfusible patients or recipient. Number three, alternatives and indications to RBTs. And four, the importance of research in leadership and management. And in around the sort of overall sort of the overall conclusion as part of this works. Overall conclusion, or one of the overall conclusions, is studies are required to understand whether patients or recipients would find it more advantageous from having alternative modalities, and at the same time where scientists with transfusion care expertise should prompt or provide context on the importance of renal health as part of a laboratory sort of as part of sort of transfusion hematology and transfusion practices or laboratory practices. Some terminologies for listeners out there, if looking to identify similar and regarding works, include blood transfusion, blood transfusion, and blood transfusion, red blood cells, and also looking at renal, and looking at sort of looking at biomarkers, and also looking at for example erythropoietin, and sort of guidelines as well can be a terminology, can also be a terminology. So that draws this synopsis to a close. This has been an audio podcast. Synopsis is part of a Segmental Scruples series or edition. An audio podcast as part of a Rampage Sonar. An audio podcast as part of a Blitz Logistics. An audio podcast as part of a Storm Logistics production.